Hello, good morning to everyone. I'm Dr. Sridhar Reddy. Now we will discuss about the female infertility. Infertility in the female, what are the causes and what are the main solutions, treatment. So infertility in female causes mainly because of irregular periods and then hormonal imbalance, then ovulation problems, all these things. So the problem may be in the ovaries, the problem may be in the uterus or fallopian tubes. Quality of eggs are affected or number of eggs are affected, or when the period itself is irregular or delayed. Like if you take PCOD because of the ovarian cyst, these regular menses will be affected. It won't come regularly. So sometimes it will be once in 2 months, sometimes it will be once in 3 months, 4 months or 6 months also. So because of this, the ovum it will not release, so there will not be any fertility. So all these things, even if there are fibroids or any blockage in the fallopian tubes, because these fallopian tubes carry the ovum and it releases into the female womb when there is periods or menses. So this blockage is also one of the main reason. And then this infertility in the females causes some because of the age problem also. So nowadays girls are getting married very lately after getting settled down and after so many issues. And even if they get married also, generally they want to get children very lately. So they want to wait for 3-4 years or 5 years, then they'll plan for children. So all these things, generally when they plan for pregnancy, it will be more than 30 years, 30-35 like that. So as the age increases, as the females become older, the quality of the egg and the regular hormones, everything will become problem. So the eggs will become less and ovulation also it will be affected and quality of the eggs and everything. So all these things affect because of the age and hormonal problem and then ovarian disease, fibroids, all these things. How it should be solved, particularly when the menarche starts and the first menses of the girl start, it should come regularly, like monthly. The routine, common, healthy cycle will be in 28 days or 30 days. So when the period comes regularly every month, then the ovulation will take place in the 14th or 15th day. So when the ovulation takes place regularly, then only girl become pregnant. So the ovum which releases on 14th or 15th day will be having its life for 2 or 3 days, sometimes 4 days also. So generally the reproductive period, or we will call as reproductive period, between 11th to 18th day. So this 1 week is the main reproductive period of a female in every month, if there is a regular cycle. To get pregnancy, the couple should meet in these days, like after 11th day, from the date of first day of the menses. After 11th day and before 18th day, only chance of pregnancy will be more. And other days, there will not be any chance because there will not be ovum. So ovum should be there to fertilize with the sperm. So these are things which are very important. And these periods, menses also, it should be very regular. And once in a while, if delayed by 1 week or 2 weeks, that's okay. Because generally it happens with so many reasons. There may be any stress or any health issues or something. Or sometimes if your food is also not regular and if you are in a tour or somewhere. So all these things will happen once in a while. So 1 week delay or 10 days delay is okay. But regularly if it is getting delayed or if you are getting periods once in 2 months, 3 months like that, you should not neglect. There may be because of PCOD, it may be because of hormonal imbalance, or it may be because of some tumors or fibroids in the uterus, or there may be any thyroid issues, hypothyroidism or something, or in some people it may be because of any autoimmune disorder. So if there is any autoimmune disorder like SLE, RA, like rheumatoid arthritis or any other autoimmune disorders also, the uterus health will be affected, the hormones will be affected and the regular menses will not be there and this infertility will be there. So if there is any underlying disease is there, then we have to treat first that one. It may be anything, fibroids, PCOD, autoimmune disorder, diabetes. Western countries generally they will take smoke, alcohol and they smoke. So this is also somewhat affects the health, particularly the uterus health. So these things should be avoided. Of course in India we see more rarely. So this is not a big problem, but this is also one of the issue. And then physical activity. Nowadays in schools also we don't have any grounds, any sports period or anything like that. So lack of physical activity, and then you don't get perfect quality food. And nowadays even parents are also very busy in their work. So we are having online foods. So the Zomato, Swiggy, so many are there. If you order within half an hour, you'll get the food. So these foods, if once in a while, if you take once in 15 days, 1 month, no problem. But when we take it maximum times regularly, our health will be affected, because outside food generally they'll add colors and preservatives, so many things. And even oil also, they don't use costly or good oil. Hygienic condition will be very less. So many things will affect. So automatically the health it defects. So maximum we have to avoid outside foods, bakery items, soft drinks, sugar also. Generally sugar and oil also should be very less. And physical activity, walking, jogging, exercise, yoga or something, that also develops the hormones. Hormones and enzymes, vitamins will be improved, and your sexual organs like uterus, all these things also, they will be healthy and normal, so that the periods will be very regular. And the other thing is emotional disturbance, or when you are very sensitive, you will be reacted to every emotion. So here also my mental health or the stress develops. So stress automatically, it effects will be there in the health, particularly the reproductive period health, hormones and everything. So also infertility will be the main reason. So if you take total average, in India we have 10% infertility in females. So 10% females are having infertility issues because of late age or hormonal imbalance or PCOD, whatever it may be. So 10% people are suffering. So why this is? Because previously it was not there, and particularly now because since 10-15 years, because of sedentary life, and we are having now computers, mobiles, all these things also very dangerous. We don't have any physical activity. Previously there are no equipments, gadgets. Activity was very good, and because of that there was no infertility issue. There may be hardly 1%, but now it is between 10 to 15%. So we have to maintain quality of life. Then physical activity should be there. Mentally we have to be positive, confident, happy. Happiness is the ultimate goal for anything, whatever you do. You have to be happy, confident, positive. Then only the hormones, the enzymes, vitamins, everything maintained. And then diet. You have to take fresh quality diet like vegetables, more fruits, and protein like egg, non-veg, and we had exposed to sun regularly, physical activity, all these things should be maintained. And if at all, if there is any PCOD, fibroids or autoimmune disorders, anything, we are having very beautiful medicines. And generally for anything, and if you go to allopathy, PCOD, fibroids, whatever, there will be surgery only, they will do surgery. And even surgery also temporary, they will solve the problem at that time and it will come back, because the tendency will be there. Even PCOD, the tendency will be there, and again they will get within 6 months or 1 year or 2 years. So it will be repeated. And with our treatment, with our medicine, there will be permanent solution. It will not come back, and the tendency also, it will be completely go. And if there is any hormonal imbalance like thyroid problem or any autoimmune disorders, that will also be 100% curable with our genetic constitutional treatment. And our treatment is very safe and very low price also, very reasonable. So whoever is having any issues with the fertility, infertility, the problems, then they can approach us and we will give guarantee treatment, and short period only. It may take 6 months, or if there is much problem, it may take maximum 1 year. But within a year, 100% every problem will be solved. And if autoimmune disorders are there, it will take some more time. So depending on the issue and chronicity, severity, the time will be different, but there is a guarantee 100% treatment, safe treatment. Thank you very much.